Medicine has lost its way because medicine is no longer serving the patient. It's the patient who serves the medicine, the doctor. It's it. It's very simple. Who serves who? I see my first patient Monday through Saturday at 5 o'clock in the morning. Now, some people can't come in at 5 o'clock in the morning because that's not their pattern. That's fine, but they'll find someone who can. At the end of the day, a person needs to take the day off from work so they can go visit the doctor at 2 o'clock in the afternoon. So let's see, they're already paying the copay. They have to pay their co-insurance. They have to pay for the insurance itself. And simultaneously, who knows what is ending up costing them. And then they miss the entire day of work. Somehow it just doesn't make sense. And then, you can go on and on and on. But at the end of the day, who serves who? And then from the practitioner's perspective, to whom do you serve?
Welcome back to another episode of the Smarter Not Harder podcast, where we give you 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Sherr, and it's a pleasure to be back with all of you. So today's episode was a very special episode for me to record. It was with my father, Dr. Alan Sherr. Dr. Alan Sherr, my father, has been a chiropractor on Long Island for the last 45 years, and he's run a very successful practice there. And it was a privilege and an honor to be his son and also to be his podcast host as we were delving into so many topics during this podcast. So here's a brief bio on my dad, Dr. Alan Sherr. He graduated from New York Chiropractic College in 1980 and has been in private practice now for about 45 years on Long Island, New York, in a place called the Northport Wellness Center. He graduated from SUNY Binghamton with a degree in biology and psychology. He's a past board member and regional director of the Whole Health Institute and the New York Chiropractic Council. He's a member of the International Chiropractic Association and the New York Chiropractic College Alumni Association. He wrote a collaborative book in 1986 called The Heart of the Healer, which won the Benjamin Franklin Award for Best New Publication. He's been recognized multiple times over the last 45 years in so many different ways in his local community in Long Island and New York. He's a lifelong learner, proponent of self-education and teamwork in order to achieve good health and quality of life. He leads by example, that is for sure, and has incorporated his philosophy of healthcare into his personal life and healthcare management. A little bit more on my father here. His office is called the Northport Wellness Center in Northport, New York, which he started in 1995 as a holistic healthcare practice that takes a vitalistic approach to healthcare and encourages individuals to take responsibility for their own physical, mental, emotional, and spiritual health. I love the mission of the Northport Wellness Center. This is something that he's had since I was a kid. It is to direct people to the realization that life and healing come from within, and that ultimately the promotion and maintenance of health is superior to the treatment of disease. Those of you that know me and that are listening probably resonate with that mission. That has basically become my mission in my own way throughout my own practice. And he was truly the initiation and the birth of all that in very, very many ways, as you can imagine. And so he also runs as the medical advisor and founder a company called Hyperbaric Medical Solutions, which is based on the East Coast, both in New York, Boston, and Florida. So as I mentioned, this was a really fantastic podcast for me to record with my dad. He is just a wealth of information. His evolution from the early days in the 1970s, being part of various organizations that were involved in organic farming movements. I learned stories about myself actually milking cows and goats that I didn't know or I didn't remember back in those days. But we talked about his evolution and understanding nutrition, especially. That was how we started. We talked about what it is that he does in clinical practice and how this has evolved over many, many years. This has started off as being a chiropractor, but always having more of a primary care bent. And I like to call my dad but one of these sort of OG integrative functional medicine docs. We then spoke about his clinical practice and how he works with patients, his philosophy, which he actually uses the analogy of a pool, looking at the inputs, looking at the pool itself, looking at the filtration system. So we spoke a lot about that. We spoke about chiropractic in general and kind of the philosophy of chiropractic and how he uses this in clinical practice. What we spent a lot of time on was the patient-doctor interaction and how he's really been able to cultivate that over so many years in a way that's just so unique to him. He sees a ton of patients. He starts his practice off at 5 o'clock in the morning. Many days he doesn't finish until 8 o'clock at night. He does take a break sometimes. I used to work the office when I was a kid, and I saw how hard he worked, and I saw the bedside manner that he had and how he developed this and cultivated it with an opening for his patients, always giving them an opening, always asking questions, and always feeling like he's coming to a an experience or a conversation the first time. So there's so many different ways that I think all of you will enjoy listening to this podcast. If you're a clinician just starting out in practice, you'll get some good tidbits there. If you're looking at how to run a business, he has run a successful business using chiropractic, but also has a building where he has 40 to 80 allied professionals that are working with him and within that construct at any one time. So we talked about the business of medicine. We talked about the art of medicine here. We talked about how medicine has changed over the last many years and the emphasis over the last, especially since COVID, and interest in younger people trying to optimize their health more, and his excitement with the next 3 to 5 years of where medicine is going to go. I could talk forever as an introduction here. I just had so much fun with my dad here as a introduction for all of you to him and his philosophy. And I think you'll hear a lot of what he says and what I've been saying for a long time, because he's been saying it for much longer than me. So without further ado, don't forget to like and subscribe to this podcast so you never miss an episode. Please enjoy this podcast with Dr. Alan Sherr. All right, Dr. Alan Sherr, how are you today, Dad?
I'm great, thanks. So I delight in the opportunity of speaking with you today, and hopefully supporting and facilitating whatever messaging we need to get through today.
Well, this is I've been looking forward to this for a while, Dad, as you know. And the Smarter Not Harder podcast has been around for about a year and a half, almost 2 years actually. And we have over 100 episodes now, and I do a lot of the interviewing for clinicians that are with clinicians, talking about clinical practice, talking about how we can use various unique frameworks that have been figured out over many years in your case and over 45 years in clinical practice. And so you've been on my list since the beginning, and I know it's always hard to find time for you because you're a very busy guy. And so, well, today I'm excited to kind of delve into a couple different things, and we can kind of go a lot of different directions. But my first question to you, and this is kind of a question that I'm going to have a lot of fun kind of feeling with your answer, which is this: Dad, if somebody asks you what you do, how do you answer this question?
Well, so that's a lead on. So I'm gonna take it as a lead and say that for the audience, that I'm professionally licensed as a chiropractor, and I've been a chiropractor for 45 years. And the way I describe myself today is I view myself as a primary healthcare doctor who uses chiropractic as one of my tools. I love it. That's the kind of the best way to frame it.
I mean, and what I always say when people ask me about you is that you were sort of the OG functional medicine, whatever you want to call it, integrative doc back in the 1980s and 90s, before functional medicine or really integrative medicine really existed. And this sort of delves into my other question here, and we'll go into your clinical practice a lot as well, but more into the history side. Is that like when I was in very early, I remember maybe being 10 or 12 years old. And maybe it was when I was starting to get acne or something like that. And you're like, you have to stop eating sugar. And you have to stop with the fried foods, and your acne will get better. And I'm like, Dad, what's so important about food? And your answer to me at that time, when I was maybe 13 or something like that, was food is the most powerful drug that you can ever eat or take. And that really affected me at the time, I remember. And because I thought of drugs as pharmaceuticals, as most people do, and didn't think about that. I'd love to ask you how that came about. How did you figure out that food was most important? Because I certainly know that back in Seaford, in New York, where you grew up, food was not. That wasn't the goal. I think it was donuts every Sunday or something, right? So
it was donuts and bagels on Sunday morning. But it was and we also had jelly donuts. And then we would all sit at the TV and watch the football games and go to sleep.
Yep, that sounds about right.
So for me, the awareness of food, it came in different tranches and different levels. When I was 17 years old or 16 years old, I was the young man who had what was called a nervous stomach. I was the one that had chronic constipation or chronic diarrhea. I was the one that on Monday mornings when it was time for school, I was the one that wanted to make excuses not to go to school, that kind of stuff. And one day, quite haphazardly, like most things, I decided that on Sunday before the Monday. For whatever reason, I wasn't going to eat anything because my stomach continued to bother me pretty continuously. And since I was labeled as a nervous child in that context, I decided, let me see what happens if I just stop eating. And after 24 hours, my stomach felt the best that it had felt in quite a long time. After 48 hours, it was as if I had a new body. And after about 5 or 6 days of not eating, I realized, there must be something to the fact that I might be eating something that might be bothering my stomach. And then, even though we didn't have a name for it in those years, I went on an elimination diet where I started to add foods back to see which foods might be the ones that are the most significant in relationship to creating digestive distress. And very quickly, I learned that anything starch, i.e. gluten, anything dairy, milk, cheese, cottage cheese, yogurt, butter, ice cream, and yogurt ice cream appeared to be the official determinants of discomfort. And then I, of course, told my mother, and I said, Mom, I can't eat these foods anymore. And she said, well, I don't know how to cook for you, so you're going to have to cook for yourself. And that was the journey. So the journey initiated there in relationship to my exploration.
You know, I've never heard that story before, Dad. I like that. So from there, you obviously had like your own personal story here, which I didn't know, actually, interestingly enough, 45 years later. But so from there, how did you evolve into, I mean, the chiropractic framework for you was sort of your avenue into nutrition as well. These are obviously very related. Tell me a little bit about that, because I know, so this is your first experience. And then like, I just remember being in the office when I was a kid and you were taking people off of dairy and wheat and other kinds of things, and people were getting better. But I know you met a couple different mentors along the way that were very, very helpful in your clinical practice. And maybe also just talking about the chiropractic framework and how sort of it initially your experience with nutrition was within that framework. And I know it's evolved a lot, but what was the impetus or how did it grow from your initial personal experience to that?
I actually had been very blessed over the years, particularly in my early education in the world of healthcare. I have had very, very good teachers, at least teachers that have made a significant impact in my life. And in chiropractic school, when I entered into school in 1976, it's actually very different than it is today. Nonetheless, when I entered into school in 1976, the individuals who were the teachers who were extraordinarily passionate about the nature of the work that they do and the impact that they felt that they can make on the students that they had the opportunity of teaching. One of those teachers happened to have been a nutrition teacher. As a result of his influence, I like to think of him as a critical thinker. He was an individual that would pose questions and ask us what we perceive the answers to be, and then he would proceed to break it down and let us know that the answers that we perceived based on the information that we had up to that point was based on misinformation. It was based on information that was represented to us then as it is today by the official corporations who represented the various things that they were actually representing. So that's where we started to look at everything from what one perceives as cholesterol to what one perceives as appropriate eating, and the difference between food that's harvested the day you consume it versus the food that you consume that's been harvested weeks after the fact because it's been preserved and shelved in various ways. We had the opportunity of looking at water, looking at the earth actually itself in regards to the actual soil, and looking at sunlight, rain, things of that nature that really never critically thought about prior. And of course, over these many, many years, 40 or so years, it's becoming more and more evident that what I was exposed to in 1976 truly was the beginning of a renaissance of information that's now becoming more and more pertinent.
Yeah, I mean, there were very few people outside of a very small group, it feels like, that were actually interested in this kind of work. I mean, do you think it evolved out of the sort of the late 1960s, early 1970s with sort of this, like the communes, the psychedelic movements, like the going back to the earth kind of thing? Like, I know that I know you weren't involved a lot of that. I know you were too young, but like, did you feel like a lot of it kind of evolved? Like a lot of your teachers were initially part of those kinds of movements, and then that's kind of how it evolved, or was it entirely separate than that?
Actually, I think it's part of that. And again, maybe a piece of the history that you're not as familiar with that your mother and I are familiar with is that very early on in the late 70s, we were actually very much affiliated with various groups that were communally oriented. And you may not even recall, but when you were
Oh, I
an
remember.
adult, you actually lived on one. So we were very much involved in the organic gardening world. We were very much involved in how to slaughter animals appropriately. That was one of my jobs. I used to slaughter turkeys and chickens.
Really?
One of
I
the
didn't know that.
why I became a vegetarian after that. Nonetheless, we were very involved in the organic world in terms of soil, air, water, etc. And we were actually eating the food that we actually secured that day, if not that day, at least that week. And if you recall, when you were younger, you and I used to go and we used to milk the cows and milk the goats. So
Really? I did that?
you did. And
How old was I?
I would again remember, even though at the end of the 60s, I was 15 or 16 years old, which was I guess it's called the Aquarian generation. But
Pinnacle of
there was an opening to begin to consider all the things that you and I are just talking about. So it was like a breakout. And I was very much part, as is your mom, we were very much a part of that breakout. So that's kind of the sequence of events that brings me into that chiropractic world.
Yes. Well, I knew some of this, of course, but this is fun because definitely not all of these pieces here. I do remember some of this communal kind of work. I don't remember milking any cows or goats, but I unfortunately or fortunately have the same memory as you when it comes to episodic kinds of things. But so I remember when we were young, my brother and I, like we would be in the house and you'd be changing the diet on us every 6 months to a year. We couldn't have this, we could have that. We were on a macrobiotic diet for a little while. And there was a huge evolution. And what I think that this kind of brings to mind for me is this is kind of a longer conversation around the evolution of your clinical practice. I know that in the beginning, especially when you were first, as you were describing in the late 70s, early 80s, when you were starting practice, you were very much like that. The medical system does not have any use. There's nothing that's required. Everything can be done, within my clinical practice, within chiropractic framework for the most part. But it's evolved a lot over the years, I know. What do you think? I know it's kind of a big question, but I mean, now that it's 45 years, right? So I know that you've done, you were mostly doing chiropractic when you first started and maybe some nutrition, but if we can talk about maybe the evolution of your practice over the years and kind of the major changes that you've kind of, that have kind of been evolved over time, that would be really interesting for me to hear.
Well, I think that, I know based on my experience that with the experience that I've had from year to year in relationship to the population of the individuals that I've seen, which has been an evolution of my own personal growth, which is reflective of the individuals who came to see me because they would ask me questions. And
Sure.
if I didn't know the answer to their questions, I would look to understand what the answers were or explore how to get those answers. And as a result of that, I often like to say that I'm in school every day. So I'm learning something every single day because if I don't know, I want to find out or at least have some direction. And as a result of that, that's the evolution of the practice. The evolution of the practice is based on my own experience, and both from an educational perspective and most reflective of the patient population that is and still does come to see me. And even to this day, it continues to be wide-ranging, and I find it even more and more exciting every single day for a number of reasons, but the one that's most significant to me right now is the access to information. I would remind you, when I first started practicing in the late 70s, early 80s, chiropractors didn't even have access to a medical library. We weren't even allowed in.
You couldn't go into the library to actually look at the medical journals. Interesting. Okay.
We couldn't even take an X-ray below the L1 in the state of New York. We couldn't even make a referral to a physician because it was against the rules. So there's a lot of variables that existed then that don't exist now. So to get back to your question, the way my education and way my understanding and the expansion of the practice has happened has really been a result of the individuals that come to us and the needs that they express, and therefore my interest to support their needs.
Yeah. I remember the old ways that you used to develop x-rays in the office back in the house, at least when you had the office, and then you had the x-ray, all the x-rays there too. You'd do it after office hours in the back, and you'd have me hang out with you and all the crazy chemical smells.
That's right. And what used to take 30 minutes to do one film now takes approximately a half a second, if that long.
Which is obviously very nice. Very
and there aren't any more chemicals because it's all done digitally.
Yeah. Pardon the interruption. This episode is brought to you by Chiropractic, makers of precision-dosed, physician-formulated, and pharmaceutical-grade formulas in the form of a buccal troche. For this episode, check out our blue cannatine. My dad talks about it very briefly. He uses it in the morning. This is a combination of nicotine, caffeine, CBD, and methylene blue to optimize your focus, your productivity, and just to get shit done. You can take a quarter, you can take a half, you can take a full. No come down, no crash. 3 to 5 hours of focus and productivity. Go check out Chiropractic.com. Blue Cannatine, and save 10% on your order by using code POD10 at checkout. Now back to the show. Yeah, as a brief aside, and I think this is helpful because there are going to be people that are listening that don't have as much experience with chiropractic, obviously, and then maybe have the question that you get a lot, or that I get a lot, at least I used to when I was in medical school and telling people that my dad was a chiropractor, is that chiropractic is so dangerous. We see all these complications from people that get chiropractic injuries. What's your stance on that? I know what it is, but I'd like you to tell people what your sense of the safety of chiropractic in general.
I do get asked that question at least once or twice a week. And I always like to frame it for a person from the perspective of malpractice insurance. Mm-hmm. So if we were dangerous, I would have one of the highest malpractice insurance premiums of all the health professions. And we actually are the lowest. So for the highest amount of malpractice, I pay $3,000 a year. So that tells you that chiropractic is not very harmful. Now, does that mean that people don't get harmed? Sure they do. And I think that's representative of the training of the various individual, et cetera, et cetera, et cetera. And to also note, there are many, many different approaches, at least from a technique perspective, in relationship to what's called adjusting the spine. So one just needs to know when, where, and how. The founder of chiropractic used to say that I could train a chiropractor in a weekend, but when to use it and when not to use it will take a lifetime.
Yeah, that's pretty profound, but I can imagine so much of this. I mean, I know that you have various sort of screening procedures that you have in place where you won't adjust various locations without x-rays ahead of time. And I think most chiropractors are learning about this when they're in school too. But the art of the adjustment is such an interesting one. I didn't know I was going to go here with you, but I know that, in the beginning, I'm sure it was a much different experience. Now, I mean, you're able to adjust a lot of people every day without even, thinking about it. This is sort of second nature to you. But as chiropractors are kind of coming out of school, do you think it's just getting the miles and just getting more adjustments in? Or is there some sort of special sauce that only certain chiropractors like you are able to do over time? Or if there is a special sauce, what does it require outside of just learning chiropractic?
I'm going to give you an example with that from being in school. When I was in school, one of my mentors, we used to meet once a week in a philosophy club. And the philosophy club,
nice.
we at the beginning of each of the class of these programs, he used to introduce us to Joe, and there were two Joes. One Joe was dead and one Joe was alive. Okay. He said, okay, everybody, we're going to adjust dead Joe and we're going to adjust live Joe.
Okay.
What's going to happen to dead Joe? Everybody raises their hand. They say nothing. What's going to happen to Live Joe? And the answer was something. All right, so that's our starting point.
Okay.
And then he would say, okay, now Live Joe has X condition, and we're going to have various chiropractors come and work on Live Joe. Some get results and some don't. What's the difference? Is the difference the technology, or is the difference the doctor? And of course, at the beginning, our answer was the technology. So what transpired was we all became aware of the fact that it wasn't the technology that was making the difference. It was actually the individual performing the technology, but just in this context was the chiropractor. And the extrapolation of that over my years of practice has been, it's not just the chiropractor, it's anybody in any way, shape, or form who's in a position to support another. At the end of the day, it's not what they say, it's what they do and who they are.
So what you're really just referring to here, Dad, is the personal growth and the transformations that you've kind of made throughout your evolution as a practitioner. What do you think? Obviously, I know you've had some of these early teachers, but do you really kind of think, and you mentioned this earlier, as you were learning from everybody that was coming through the door, but how did you become the clinician that you are? Is there any other secret sauce there? Was it, just the sort of culmination of all these factors that we've already been discussing, like your mentors, and the patients and your curiosity? Are there any other things that I'm missing there?
Well, no, I think what you do is you hit on all of those things. I think at the end of the day, reframe that comment. In the nature of our experience will determine the nature of our expression. And the various individuals and teachers, etc., that we come in contact with throughout our lives determine, shape, and create the context through which our expression manifests. And that starts, right from the moment of conception all the way on. And for some, maybe even before conception, depending on what their belief system is.
Sure.
So it's not to make it, this is not like an aspect of exceptionalism in any way, shape, or form. I have been blessed. I have been blessed with great teachers throughout my life. And even though, for example, I may not have thought of my parents as great teachers, they were great teachers. And I probably have respectfully acknowledged that more as I've gotten older than when I was younger. I think all of us probably have an experience where we think our parents don't know anything. And then we realize that they knew a lot more than we thought. And then when you get as old as I am, you realize they knew a lot more than I thought. And now I'm kind of becoming more and more like them in relationship to my experience. Mm-hmm. So to kind of answer your question, I do know that the nature of who I have, what I have become and what I continue to evolve toward is really a reflection of the openness that I have to the experiences that are presented to me. Mm-hmm. And because it reshapes the nature of my thinking. Mm-hmm. So I now know that I'll say the earth is not flat. I would tip the earth is actually elliptical.
Okay, good. Okay.
Where I used to think it was round. The same idea. The same idea. So, and again, it puts us in a place where where for me, it was always critically thinking. I mean, someone would say something and I know they're passionate about it and they're excited about it. And the question for me is, yes, I hear their passion and excitement. And is it true? And that's the critical thinking piece. The critical thinking piece says, okay, let me understand this. I do recall when I was in college, one of my areas of interest was research, and I had the opportunity of working with various individuals who were very well known and well regarded in their fields. And it became apparent to me in the context of that educational experience that, as an example, numbers don't lie. People do. And you never, even though you may go in a research world and with a null hypothesis trying to prove yes or no, wasn't as clean as that. I discovered very quickly that you go in with an interest to prove what you want to prove. And then effectively what you can do as a result of that, you can make the numbers fit your interest. And it made me realize very quickly that a lot of the research that we actually read on a day-to-day basis, and that is represented as the truth or as science, oftentimes isn't as clean or clear-cut as it may be represented in the news or in the journals. So again, as you could see, I chose chiropractic as my field of interest. Actually, the funny part is I really didn't choose chiropractic. Your grandmother did. So as a result of that, again, there's always more to everything that meets the eye, and a critical eye is the most important.
Yeah, I think that's really kind of the nature of what you do, is a critical eye with everything. And I wanted to delve into I know this has evolved over many years, your clinical practice and how you're thinking about things. I know most recently, you've been using this pool analogy a lot that I'd love to chat about a little bit with you, because I think it's a great way to kind of understand the evolution of your practice and how you think about things now. But obviously, everything that has come before has colored how you're thinking about your framework. But let's talk about pools, Dad. I would say that the one that's in your backyard, I really wish you'd gotten earlier in my life so I could have enjoyed it when I was in high school or college. But just
now your children do.
Yeah, my children do, at least, yes, which is good. They love coming to New York every summer to hang out in the pool. But now I don't know when this started, but let's talk about your pool analogy and how you talk about this with patients.
Well, I like to step back a bit, and I always think that of the best teachers in my life that I've ever had are the teachers that make it the simplest. Mm-hmm. And therefore, as a result of a simple representation, it makes so much sense. And I often know from my own experience that when I first start learning something, it appears much more complex. And as a result of that, I jump into the frying pan. In other words, you get right into the weeds.
Right.
And when I was first starting my practice, particularly in the functional medicine context, talk about the weeds. You mean you really jump in. And I found that the explanation to myself as well as to the people that I was taking care of was very complicated. And for whatever reason, it continued to baffle me that it somehow wasn't making a lot of sense. Nonetheless, we were able to help a lot of people along the way. And in the context of that, the nature of the explorations as well as the understanding of the material supersedes the technologies and the specifics. And as a result of that, I've recently moved into the world of swimming pools. So the way I like to simplify it, pretend I'm just a teacher and I'm got all my students around, and I say, okay, everybody, today we're going to talk about swimming pools. There's only 3 parts to the pool. And I know for those that are technical, there's a lot more to the pool than just 3 parts. But from my understanding, there will be 3 parts to the pool. Number 1, the water that goes in. Number 2, the filter that filters the water. And number 3, the pool you swim in. Mind you now, the pool you swim in is only as clean as the quality of the water going in and the function of the filter. I said, let's continue to break it down. Western medicine is about shocking pools. They use pharmaceuticals. Functional medicine is about shocking pools. They use vitamins, minerals, herbs, homeopathic remedies, and nutraceuticals. Holistic medicine, which I practice, is about optimizing the function of the filter. When people ask me what I do for a living, I tell them I am a filter tweaker. I am a chiropractor professionally, and that's what I do. There are many filter tweakers, not just chiropractors. Mm-hmm. And there are also many modalities that are used to tweak the filter, i.e. the immune system. At the end of the day, though, all the work is yours. The input, the quality of the water going in. Now, I can't change the quality of the water that has gone into your pool from the moment you were born until today, but we can change the quality of the water today. And I can tell you, based on my experience, that the body is extraordinarily forgiving. You can abuse it for years and give it one day of wonder. It says thank you in a way that you probably couldn't even comprehend until you actually do it. And then what I do is I frame the input piece, and the inputs piece is where I spend a lot of my time. Now remember, From our perspective in the functional medicine field, a lot of the work is done in measuring the pool.
Mm-hmm. Mm-hmm.
So we do testing.
Right.
A lot of the work is looking to understand how to optimize the filter. And at the end of the day, though, if the patient is not changing their input, it almost doesn't matter, because we're not any different than the Western model, which is basically symptom care. Now, again, that is appropriate for a time and maybe for the entire time. Yet our understanding has shifted to such a degree that we realize the input variables are significant. So I like to frame that in 4 contexts. So number 1 is spiritual, number 2 is emotional, number
These
3
are
is
inputs we're talking about. These are the input. You have the inputs.
the input.
Yeah,
So you have the spiritual, you have the emotional, you have the physical, and you have the nutritional. In my work, I don't spend a lot of time talking about the spiritual and emotional. And at the same time, I let people know that that is extraordinarily important. And then simultaneously, I'll spend the rest of my time on the input side talking about the nutritional as well as the physical. Mm-hmm. I frame everything from the perspective of my teaching, of what I learned when I was in school by my various mentors. We're always reminding everyone that it is not the technology, it is the person. And the nature of the individual's interest in optimizing their function will determine the nature of their outcome. So I'm going to give a brief example.
Please.
A number of years ago, I was invited to give a presentation to a church group, what I call gray hairs, women who are over 80 and they all have the same color hair.
I think they call them blue hairs in the UK because for some reason they have blue, but Sam, I did. Understood. Yeah.
And I was invited to give a presentation on nutrition. And I arrived a few minutes early and they offered me a cup of coffee and a bagel, which I kind of thought at the beginning for a talk on nutrition was an odd choice. Nonetheless, though, when I got to the front of the room to give my presentation, something came over me and I realized I had to ask a question first. And the question I posed was, how many of you in the room have a reason to be alive? No one raised their hand. Mm. Now, either they were completely like, they just were overwhelmed by my presence, or they really didn't have a why.
Or they were just shocked at your question.
Yeah. And they really didn't have a why.
Yeah.
So I stated then, I said, if we don't have a reason to be alive, why are we going to talk about nutrition? So why don't we just spend the rest of the time talking about why? So I spent an entire hour talking about why. And at the end of the presentation, I said, okay, how many of you have a reason to be alive? And they all raised their hand, which was wonderful. I guess I got my message across. The challenge is, of course, they never invited me back to speak on nutrition. That's kind of like my introduction to the input piece.
So it's it can be a smokescreen then, is what you mean. It could be,
that's right.
It's a conversation about nutrition, about exercise, about spiritual, emotional health, but really we're not going to talk about any of those. We're going to talk about something that entirely, well, maybe it's all a part of that, but it's not going to be like, what food are you eating? I'm just interested now, what was the conversation? What did you tell them? What gave them a why after an hour of speaking with them, Dad?
I asked them how many people had grandchildren.
Okay.
That was the first question. Mm-hmm. And then the second question was, how many people volunteer? And then I went on and on and on. And then my last question was, all right, we're in a church. How many of you believe in God? And you can see they reluctantly raised their hand.
Okay. Reluctantly raising their hand in a church. I like that. That's good. Okay.
So my experience, this is my experience, when an individual does not have a belief system or a faith in something greater than themselves, the nature of their experience in relationship to the process that you and I are now discussing is completely different, even though they may use the same tools.
Yeah. And this is actually what I was thinking about as you were talking about the inputs, and then it's on the person themselves to change these once you've given them the understanding of what is required. But where's the motivation, right? How do you create the motivation? And I guess this is the way you were able to do it for these church ladies, is give them a why.
A why.
Is it similar for the people coming into your office, trying to find out where their lever is that you can pull or press or whatever to make them have Well, why? Because we know that the hardest thing to do with patients, and you know this more than anybody because of how many people you see, is you can give people information until the cows come home. But how are you going to get them to change those inputs? Because like you said, you can't out supplement yourself out of a shitty diet. You can't out hyperbaric yourself. You can't out chiropractic yourself. It doesn't, you can just whatever, fill in the blank of whatever it is. What is, or how do you do that with patients? Is it always the same initial questions and then going where they need to go?
I'm going to say that a lot of it's organic, because I don't have to put on a show. I just am the thing. There's a certain vibration or an energy or something that individuals pick up as a result of the genuineness of a person.
Yeah.
And I think one of the variables, and actually I was discussing this with a couple of colleagues last night at dinner, one of the variables I think I know that is representative of a connection that is being longed for by individuals is that we're not looking for teachers. What we really are looking for are people who are working the process with us. Mm-hmm. And the best teachers are the individuals who are working the process, not the people who think they know, but know not that they know not. The people that know that they don't know, and that we're still working the process. And even though we may be older in years and maybe have more experience, it doesn't necessarily mean that our process is any different than the next person's. So as a result of that, the connection with an individual is really the primary variable. Mm-hmm. And in the doctoring world, it's, there might have been this view that the doctor knows best. And in my world, I often say to people that the patients, the individuals that come to see us, is that my starting point is that I don't know. Mm. I have a lot of experience, and I'm going to hear your story, and I'm going to make recommendations based on the story that you've presented to me. And at the end of the day, I don't know. Mm. And I try my best to go in neutral, rather than working with an algorithm that I think is going to be true for everybody. Welcome to the challenge of the world that we live in, because it's an algorithmic world. So standard of care is standard of care. And if you don't fit into standard of care, you don't fit. Really? No, I fit. I just don't fit into the algorithm of the standard of care that someone made up. Right. So it's the technology piece versus the real person piece. And that's reflected in everything that's happening, at least in the United States, in real time, where science isn't the end all and be all. Science is the representation of the individuals who have done the work to support the information up to that point. And it continues to change all the time.
I mean, I know that you have a lot of kids in practice with a lot of families. And I think this is probably, as you're talking and describing kind of how you come in, knowing that everybody's story and experience is different. I think this is probably rings true like the most with a lot of the kids that you see in practice, right? That are written off by other practitioners, and the moms and the dads are written off. I mean, I know this is a big part of what you do as well, is listen.
Right. I could tell you that in the last 5 years, maybe 6 years, probably right pre-COVID, we call it pre-COVID and post-COVID, or BC and AD. Before COVID and after, BC.
AC, yeah, I got it. Yeah.
The population of our practice model has changed significantly. Where I would say that in our facility, in our center, we see around between 4,000 and 5,000 office visits a month, and I could tell you that 2/3 of it, maybe more 5 years ago, was between the ages of 50, 60, and 70. I can tell you now, post-COVID, that it's 30s, 40s, and 50s. And to me, what that represents itself as is young families, or families with older children, i.e. teenagers, college-bound, and new families with newborns. There's been a shift. And I think the shift is the fact that and which is very exciting for me, in the sense that individuals are now seeking They're moving away from what we call algorithmic or corporate medicine, and they're now moving into the world of, okay, what do I need to do to change my input so that I can have a better experience and not become part of the acquired variables of the pharmaceutical companies and the technologists of the world, so that I can keep myself going as long as possible. They're looking for a different experience, if not for themselves, for their children. Mm-hmm. And that to me is extraordinarily exciting. And that's actually the initiation of my work when I started practicing in 1980 and became aware of most of my work prior to giving it a definition in the early to mid 70s.
Part of the interruption, this episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. For this episode, check out our metabolomics module. This is our foundational module at Home Hope. It's optimizing vitamins, minerals, nutrients, and cofactors to optimize health rather than treat disease. This is the philosophy my dad has had for decades. Now we're operationalizing it using metabolomics as our foundational way of using laboratory testing. Go to homehope.org and save 10% on any module by using code podcast10 at checkout. Now back to the show. When you talk about, working with people and listening, but you talked about they don't want a doctor coming from a high pedestal telling them what to do. They want like a partner in their care. And I think, but the other piece of it, which I think is really interesting, that very unique to you, is that what you're really talking about is even more than, walking the walk. It's because that's a big part of it too. I find that more patients now that I see, they want to work with a clinician that is doing what they say that they're asking you to do. They would not ask you to do anything that they wouldn't do themselves, that kind of thing, or they haven't tried themselves. And I know that this is the case for you with what you do, but there's even more of it is what you're saying here, which I think is interesting, which is that it's the ability to say that you don't know, and then making it so that you don't have any preconceived algorithmic notions as to what it needs to be. And I think that's just come from just lots of clinical practice over many years, I would imagine, to be able to take all that experience of those, the huge amounts of people you've seen, and then all there you have in front of you this person, you can somehow go blank and just allow it to come.
Correct. And then remember, at my disposal, I actually know for a fact that I have 48 different professionals that I can refer to tomorrow. And if I needed to that minute, I can text them and say, X, Y, and Z is going to come to see you. Do you have space today in your practice? Because I have the availability of that kind of field to support an individual in relationship to their process where they are at that time.
This is a big factor.
That's one of the wonders of the process. This is old time medicine. This is like, the Dr. Welbys of the world. You're too young for Dr. Welby, but Dr. Welby was a TV show and he was the family doc. Like he knew everything about the family. He knew about each of the siblings. He knew about the uncles and the aunts. It's like he had history already, and they had history already built in based on the presentation of the individual. That has been lost. One of my colleagues often says is that medicine has never changed, except they stopped teaching medicine years ago.
Yeah. Well, what do you think we can do, Dad? I mean, in the sense that first of all, there's a lot of questions I want to ask, but I guess the main question I'd ask now, but I want to talk about how you've created these networks of individuals and practitioners that you can that you rely on, because I think that may be a way in modern medicine now, given the limitations of clinical time and just expertise and the inability for people to see as many patients as you do, was to create these networks of individuals that can help support you. But I guess my question is what can we do now as clinicians? And maybe this is part of the answer already, but I know that most clinicians are, and as most clinicians cannot work like you do. They don't have the capacity. They don't have the experience. Where can we go from here? Where do you see that clinicians can get the experience, or how can we create this now in sort of modern, in modern parlance, in modern time?
Good question. I don't have a really good answer.
Okay.
What I do know is that at the independent practitioners, the doctors who have chosen to be outside of the corporate model, we have a number of pressures Number one is we're passionate about our work. And number two, we also want to support our families, pay the bills, and do all the various things that everybody else wants to do.
Right.
And the challenge in any working space is to understand how to do that. I have been very blessed in the sense that I have been very successful in managing both of those scenarios. That's not that's not typical. So that's kind of where we find this thing. And a lot of the reasons why many physicians work in the corporate world, because this way they know they're going to get X amount of dollars. And then if they want to explore, they have the option of exploring. For those of us who have opted out, I mean, one of the things I like to say to my colleagues is I'm so happy corporate medicine never came after chiropractors. We didn't fit their paradigm because we don't fit the algorithm, because we don't operate in an algorithm. And at least the older chiropractors, maybe the newer chiropractors, depending on what school they went to, will operate in an algorithm, particularly if they're only working in a musculoskeletal context. Keeping in mind that a lot of people, when they think of chiropractors, think of necks and backs. Right. When I think of chiropractic, I think of Dr. Welby. I think of the old-time doc, primary care, who uses chiropractic as one of their tools in relationship to the process of caring for that individual. So that's the mix. And finding our way through all of that is always challenging for each person. And I'm not sure how to kind of bring it to another level. Because remember, one of my friends asked me if I was going to do it all over again, what would I do right now? And I said, this is what I told them. I said, I need a 20,000 square foot space. I need one floor. I need 150 parking spaces. I need a lecture room, and I need a technology room.
Okay.
He said, really? I said, yes, in my next life.
I love it. I mean, you have, yeah, go ahead.
So notice I said on one floor, one-stop shopping. You see where I'm going? But what happens when you start to do that? Then all of a sudden you get into the corporate model. And all of a sudden you're starting to do what? You're starting to do the very same thing that evolved into what we currently see in medicine. So that's the overall challenge. The overall challenge is to provide the service, make it monetarily appropriate for the individual who is providing the service and the person who is receiving the service, and then simultaneously have a win-win for both. Good question.
It's a good question.
Happy to explore.
Yeah. I mean, this goes along. I mean, when you're talking about networks, I mean, I think what you've really worked on in Northport, where you are, is creating a network of individuals, as you said, of practitioners that can really support, what you're doing, and you can support what they're doing, which I think is really amazing. And then what actually is also very, very cool is that you have so many of these clinicians all under the same roof, right? You have the Northport Wellness Center. You can tell me how many clinicians that you have now that are either in the building or affiliated.
48.
There you go, 48. So it's a lot. And so when it comes to looking at a business model that has worked for you, I know it's changed a lot over the years. You have a huge amount of staff. You have 48 different practitioners that are working in the office in their own separate entities. This is not all under you, which is to be clear. You evolved a lot. Maybe you can talk about your evolution on the business side a little bit and some of your learnings that you might feel like could be helpful for people that are either getting started with practice or that have been in practice and are tired of working the way that they are. Maybe they're in corporate and they want to get out of corporate, or maybe they're in the same kind of realm as you are and like just looking to make it work better. I know that you've had a lot of trials and tribulations along the way to make it work as you've described. But what are some of the through lines there? Some of the things that really you felt made a huge difference along the way as you were creating the practice and how about and now as well?
Well, I'll start off with a story, and my story is, if you remember, your grandfather and now your uncle run a business, and that is a family business that's generational. I believe it's the third or fourth generation now. And in those years, when I was a teenager, my brother and I, if you recall, were being trained to actually take over that business. Mm-hmm. So we grew up in the business world. And when it was came time to have the conversation about, okay, who's next in line to take over the business? I'm the oldest son. So of course it was my turn. And I said, no. I said, I don't want to be a businessman. Too much yelling and screaming. None of this really makes any sense to me. And my father said in his infinite wisdom, just remember, whatever you do in your life, it's all business. Okay, fast forward. So I'm thankful for all of that education when I was younger.
Sure.
And by the way, your uncle still runs that business.
I know. If anybody's looking for a glass business, I think it's for sale. So,
unfortunately, generationally, you're correct. I don't believe his boys want to take over the business.
Yeah.
So in that regard, that's kind of it. In a sense, I had a business background. And then when starting the practice, even though with the passion and excitement and the idealism of doing what I was doing, possibly less articulate than I am today, then still made a zillion mistakes, still didn't have a clue what I was doing, but yet at the same time, I still had a business background. All right. And I think that's really the variable in the puzzle that over the years I have managed to operate it. And then when I needed advice, I would either hire consultants or I would call my father. Say, Dad, what do you think? He says, how's business? I said, no different than it was when you and I were in business, except we're not yelling and screaming.
Hopefully not as much, right? And there he was yelling at you at 4:00 in the morning when you were loading glass trucks, if I recall. Trucks. Yeah,
that's correct. So it's that's the context. The context is, unfortunately, a lot of people are going into to be an independent practitioner means you really have to have a sense of how to run a business.
Yeah.
I know for a fact that the education of our children today, of your children, of Mike, of you and Jared, your education came from the fact that your father and mother taught you the business piece outside of the context of schooling. Unfortunately, in the school system, that is not taught.
Especially even in the professional schools too, we're talking about, not in chiropractic school, not in medical school. Yeah.
That is correct. And as a result of that, moving into the corporate world makes more sense, because at least you get a salary. And then on the other side of that, remember, most of medicine, including chiropractic, there may be more so chiropractic, it's very entrepreneurial, which means the way I like to think about that is necessity is the mother of invention. Mm-hmm. Not just in the context of making money, in the context of growth and development. In the context of growth and development, the pressure of opportunity is created by our passion and excitement. There needs to be pressure to create change. So if there's no pressure, there is no change. So as a result of that, you can have the lemmings going to work every day, or you can have going to work every day and say, oh my God, what is life going to bring me today? And that changes the nature of the perspective, which is what I meant when I said earlier, when a person has a belief system that's greater than themselves, it's what is it that life will bring me today versus, oh, today's just another day.
Yeah, it's like what is life happening for you or to you kind of deal, right?
That's correct.
Yeah.
I see that a lot in, just when in an individual's experience and relationship to why they come to see us. Mm-hmm. We have a policy in the office that pain does not wait. So if a person calls the office for the first time, or if they've been to the office before, oftentimes we're extraordinarily busy. We have what we call ish appointments, which means people make appointments, and on the other side, people just walk in. If my car is in front of the building, they know they can come in. And pain doesn't wait. And sometimes all you need to do is walk into the room, say hello, tell me what's happening, let me do X, Y, and Z. Okay, you're okay. Come back tomorrow, make an appointment for a little bit longer so that we can do A, B, and C. All they need to do is know that they're okay. Versus, well, Dr. Sherr doesn't have any time for you today, but he can fit you into his schedule 10 days from now. Is that okay? No, it's not okay. So that's context for you.
Yeah. I mean, when it comes to the running of the business itself. You have a lot of different moving pieces now. And obviously I always tell people sort of two things with medicine, right? Like if you're an individual practitioner like you are, you're in a business. That's number one. And number two, I think what you just described, and maybe it's sort of like in the reverse order, like you're in a service profession, right? So you are here to service or to help others. And so trying to marry those two things is hard, though. Trying to marry like a business model that works, that can sustain you, and like you said, to help raise your kids and get them to college and things like that. At the same time as finding a business model that works has been a challenge, though, even for you, Dad, over the years.
Absolutely. Yeah. And at the end of the day, it's always, though, who serves who. Medicine has lost its way because medicine is no longer serving the patient. It's the patient who serves the medicine, the doctor. It's it. It's very simple. Who serves who? I see my first patient Monday through Saturday at 5 o'clock in the morning. Who serves who? It's really simple. It's really that simple. Now, some people can't come in at 5 o'clock in the morning because that's not their pattern. That's fine, but they'll find someone who can. At the end of the day, a person needs to take a day off from work so they can go visit the doctor at 2 o'clock in the afternoon. So let's see, they're already paying the copay. They have to pay their co-insurance. They have to pay for the insurance itself. And simultaneously, who knows what is ending up costing them. And then they miss the entire day of work. Somehow it just doesn't make sense. And then, you can go on and on and on. But at the end of the day, who serves who? And then from the practitioner's perspective, to whom do you serve? Mm-hmm. Are you serving yourself? Or are you serving something greater than you? And when the practitioner has the same view that I am here to provide a service, that I have been given, I have this gift. And as a result of receiving this gift, which is from someplace greater than me, I have the opportunity to now provide that gift. Mm. And it's the same head. If that goes all the way through, then that's where the healing really happens. It's like when a person gets the chills because you finally hear the truth. They got it. I got the chills. All right. And it doesn't mean you even had to touch them. You just got the chills. And it's the same thing. And that's the excitement of the work. The excitement of the work is being in the zone, being a reflection of that which is greater than you, and that is who you are. And then reflecting that to the people that you're working with. Many people will get that and some won't, which is okay. The other day, I had an individual who was very unhappy with what was going on. And I said to them very nicely, I said, I really do appreciate that. You probably would be better served if you go see A, B, and C versus seeing me. And I'm really okay with that. I'm really, really okay with that. Because I want you to receive the best care that you are ready to receive. That's it. Pretty simple.
So that's the nature of, it's not always going to work out with every patient that you see, right? It's not going to be, there's something that Dr. Ted likes to say, which I like as well, is like you're not going to be able to create a therapeutic relationship with every patient that comes through the door, especially at the volumes that you do, Dad. But I have a question for you. This is one that I haven't thought about until now. How do you do it? Like, how do you maintain that flow for such a long day? Like, I know what you just described to me, and I know that you live it because I've been in your office. As many people know, I've said on previous podcasts, I was coloring in the front room where you were practicing first, and then I was collecting money and behind the front desk so that I could go to college and that you could give me some cash to hang out with my friends. But how are you able to do it? Like in the sense of maintain that flow, maintain that perspective throughout, the days. I mean, what do you think are some of the main ways that you're able to do that?
To a large degree, I live what I am, or I am what I live.
So you're walking the talk. You're talking.
I'm walking the talk. And does that mean I'm perfect? No way. Do I use various tools? Like, do I use some of my newer tools like Tro Blue with Canatine? Sure, I do.
Yes. And like have 17,000 rides on your Peloton?
Yes. And I have various game changers. Like, I use the sauna on a regular basis, and those kinds of things. But at the end of the day, though, people say that, what's the secret? What's the secret? I think the secret is true for each of us have a different way of translating whatever that secret is for each person.
Sure.
I'm just compelled. At the end of the day, I got a fire. And as long as that fire burns, I will continue to get up at 3:00 every morning, which is what I do. And I will meditate in the morning when I get up, and I will give thanks for giving me another day. And then I will provide and send out a mailing to my entire mailing list. I will review my emails. I will prepare to go to the office. I will go to the office and prepare my day. And some days are great and some days are not so great. Like the other day when I went to work, it wasn't so great. And my staff knew it wasn't so great because I let them know it wasn't so great. And hopefully they still love me even though it wasn't so great. So it's being okay with not being okay and being okay with, I call it uncomfortably comfortable.
Sure.
Yeah, uncomfortably comfortable. I think I live every day of my life being uncomfortably comfortable.
Yeah. Yeah. And you've always said that. I mean, since I was a kid, you've always mentioned, I think, a couple things. One was being okay with being uncomfortably uncomfortable in that way. Always trying to push, knowing that that's just the nature of being curious and of progress. But the other part that sort of corresponds to that, which I always found very, very helpful, especially when I was going through training, was that you'd always mention about the process. And you talk about this with a lot of your patients too, I know, but enjoying the process. That was a huge part of how I got through medical school and residency and training, knowing that I really didn't want to be a conventional doctor, as it were. But the enjoying the process is, I guess, the part that allows you to maintain what you've just described, right? Like, it's a process, there is no end goal.
And again, I've had some good teachers along the way. A story I probably never told you is that I'm in my last 4 weeks of school, chiropractic school, and I'm so done. I don't want to be there anymore. And I'm with one of the individuals who happens to be, I'm still alive and very much a good friend and one of my teachers. And I said to him, I'm done. I can't do this anymore. I'm leaving. And he looked at me and he said, that's the stupidest thing I've ever heard. He said, you got 4 weeks, finish school, get your degree, and then have a nice life. And I heard him because, again, very respectfully, if I didn't hear him, I would have left because it made no sense to me anymore because it was completely redundant. It was almost silly. It was like, really? Why did I have to go to school for 3.5 years to figure this out when I really only could have done it in a week?
Mm-hmm.
And yet, that's the immaturity of a young person in relationship to my enthusiasm and excitement about life. I figure I already know all this stuff. No, I didn't have a clue. Nonetheless, though, I'm excited for the opportunity. Falling back to what we started at the beginning, I had great teachers. I am blessed with the fact that at least my eyes were open and my ears were ready to hear when they were ready to see and ready to hear.
Right.
Otherwise, the experience that I'm having, I would not have had. So someone asked me the other day, they said, if you were going to do it all over again, what would you do different? And I said, nothing. If you remember, you asked me that question. You asked me the question about, all right, Dad, what do you think? Should I become a medical doctor or a chiropractor? What did I say to you? I said, Scott, knowing what I know today, unfortunately, if you feel that medical school is the place for you, that's where you should go. And you said, why? I said, because you get the keys to the kingdom. You said, what does that mean? And I said, medicine is not about healthcare. Medicine is a business. It was created by the wealthiest people in the world to ingratiate themselves and the generations after them. And my hope is that you will be able to be one of those who can help facilitate the change in that world. And I can tell you, and I have been blessed, you have become and are becoming more and more, day to day, one of those people that have the opportunity and have taken the steps to make that happen. So that brings warmth to my heart.
Oh, well, I appreciate it, Dad. I mean, and I remember that conversation very well because I remember the love of science, the love of your practice, the love of seeing people, of being involved in, like you were talking about, your parents, my grandparents earlier. And like most of my bedside manner, I realized is because of having to deal with your parents. And a lot of your bedside manner with your patients over the years is because of having to deal with the craziness that was your family. I mean, every family is crazy, right? But everybody was, so growing up in the practice, seeing what you do, like I always knew that I wanted to be involved in helping as well. And, going to medical school was a very big challenge for me, as you know, because it was extremely out of whatever I had experienced as a child by a long shot. I had no idea what medical school was. But as you said now, like now 30 years, 20 years later now, over 20 years since school, since residency, just about 2000, I'll be 20 years in 2027. So it's coming up. That's the evolution that I see in medicine, right? The evolution of bridging those gaps between the alternative world that you so much, grew up in and, cut your teeth in, and then the conventional world now that more and more people understand is broken. And there is just nothing that we can do from inside the system, that we got to find a way to work on something from the outside and then create a whole new system entirely. And I'm really happy to be part of that, I hope. But in that framework, I would love to ask you, as we kind of wrap up here a little bit, where do you see medicine going, or where do you see health going? What are you excited for? I know that we have a new administration and we don't need to get into politics or anything like that, but more in the sense of like, where are you hoping that we can go now that there are people like me, because of you, that, and at least me specifically because of you, that are in this world trying to make this work, trying to find a new way forward. You're seeing this in real time with your patients. You're seeing how things are changing. People are more interested in health. Like, where do you see the next, 3 to 5 years in health and wellness, and where would you like to see it?
I will tell you that I'm guardedly optimistic in the sense that I do sense that the next 3 to 5 years are a renaissance in regards to health and wellness awareness, and a shift in the paradigm, call it from pharmaceutical medicine to health and wellness medicine. Call it what we wish. I'm enthusiastic about the picture of that as it's being represented currently in the designation of Make America Healthy Again. I've lived that for 45 years, actually probably longer, without being conscious.
Sure.
And when we can have a conversation about Fruit Loops and fluoride and all the other things, and we can actually have a conversation about it and not have it censored, that's a home run. Let's find out what the real answers are. And if they are the old answers, that's great. And if they aren't, let's discover what they are. And let's understand why we have more chronic illness in children than ever before. Let's understand why we spend more money in relationship to quote unquote disease care in the United States than any other country in the world. So we're the sickest country in the world, yet we're the wealthiest country in the world. Mm-hmm. Let's understand why all of that is happening. And if it's not because of what we think, let's look to understand what it is. And the only way we can do that is by having a conversation about it without being chastised, without being demeaned, and without being deplatformed.
Yeah.
In the technology context. So in that regard, I am guardedly optimistic and extraordinarily excited. And I can tell you, we've been doing that for years in an office setting, and now it gets to be done in a larger platform, even that much more exciting. So one of my mentors along the way used to tell me, if you ask a question to someone and they choose not to answer you in a way that's demeaning, it's just because they are not ready to give up their answer. But the best teachers in the world are those who know and know that they know. And therefore, any question is perfect. Please help me understand. That's my favorite word. That's my favorite entry point in relationship to any conversation. And those around me know that, because some tried to emulate that as well. They always say, as I would say, please help me understand why you think the way you think. So it could help me better frame my thinking. And if my thinking needs to change, I'm happy to do that.
I love that. I know that you ask that question a lot and are able to get so much from somebody in a very short period of time, if you can help them clarify their own thinking, because most people have no idea why they think what they think or why they do what they do, because they've just never listened or never thought about it. It's just what they do. And so having that meta awareness, that metacognition as part of the ecosystem, as part of the conversation is fantastic. All right, Dad, I have one more question for you. And this is, there's so many things that I've actually learned about you this has been fun just to be here with you. So thank you for doing this again. We ask the same question at the end of each podcast, and it's a very simple one. And you've answered this mostly already in various ways, but the name of the podcast is Smarter, Not Harder. And so we ask all of the guests at the end, what are 3 ways that you would recommend living smarter, not harder, either in your own personal life, professional life, a mix of the both, whatever you feel would be helpful for people to kind of get that smarter aspect rather than having to work harder all the time for things. What are those 3 things for you?
Help me understand, number 1. Number 2, representing myself as neutral without having an answer before I hear what the other answers are. That's number 2. Number 3, you hear me say this a lot or write it a lot in regards to much of my correspondence. I'll often say and always know that the truth is true and all is well and unconquerable life prevails.
That's beautiful, Dad. There's so many, as a clinician, I think those are 3 things we all can learn and live by and help augment our practice. And so thank you for that. Where can people find out more about your office, Dad? Where are you if you can give us, the name, the location, website, those kinds of fun things.
We're the northportwellnesscenter.com. Our website is in the process of being reformed. Nonetheless, you'll get to see the old website still. And we are located in New York on Long Island in a place called Northport. And we are representative of 48 different practitioners. Some, I think 24 of them actually in some way, shape, or form on any given month represent themselves in the facility itself and balance our virtual members of our practice. And I think that's it. And I would also mention that the hyperbaric, a company called Hyperbaric Medical Solutions, hyperbaricmedicalsolutions.com, which is one of the evolutions of the history of my experience, particularly that started about 13 years ago, which is now inclusive of your younger brother as well as yourself and many others, which is an expanding opportunity in regards to the hyperbaric world and the integrative hyperbaric world that's associated with that. So I would mention hyperbaricmedicalsolutions.com as well.
Right. And there's I think 3 or 4 locations in New York and 1 in Boston, 2 in Florida. So you've been expanding there. And I think many of the listeners probably know, but if not, this is how I got my interest in hyperbaric medicine initially was through my father and his office and working with off-label conditions like people with kids with autism and others and seeing some fantastic benefits. So I'm still involved as an advisor for the company, and it's a fantastic one as well. So, Dad, thanks so much for being here. I know that spending some time with you is always a blessing for me, and I don't get to see you a lot, but we do talk at least once a week usually. So, have a great rest of your Sunday, and I'll see you soon. I hope, Dad.
All right, give my love. Bye.
Thank you so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1-cent solutions to $64,000 questions. This was a very special episode for me to record with my father, Dr. Alan Sherr, who's been in practice for 45 years as a chiropractor. He's a fantastic human. He's been a mentor of mine since I was a child, obviously. And so much of what I do is because of what he does and continues to do every single day. So I really hope you all enjoyed this podcast, at least partly as much or almost as much as I did, which was very difficult to enjoy it as much as I did, to be honest. If you did enjoy it, please don't forget to share with your friends, your family, your colleagues. Let them in on the action at the Smarter Not Harder podcast. And don't forget to like and subscribe below. We'll see you next time.